This ointment is applied to the skin to relieve itching and pain from various skin conditions, such as scrapes, minor burns, and insect bites. It can also be used to treat discomfort and itching caused by hemorrhoids, anal fissures, and itching around the vagina/rectum. The active ingredient, benzocaine, is a local anesthetic that temporarily numbs the skin to reduce discomfort. For best results, apply a thin layer to the affected area as needed, but make sure to follow the instructions on the packaging. When using the over-the-counter product to treat a boil, be sure to read all the directions on the package before applying the medication. If you have any questions, consult with your pharmacist. If your doctor has prescribed this medication, use it as directed. Before applying the ointment, make sure to clean and dry the affected area as instructed. Apply a thin layer of medication to the affected area of skin as directed. If you are using the spray, shake the can well before using it. Hold the can 6 to 12 inches away from the affected area and spray until it is wet. Avoid spraying near your eyes, nose, or mouth. Do not use the ointment on large areas of the body, cover the area with waterproof bandages or plastic, or apply heat unless your doctor has instructed you to do so. Doing so may increase the risk of serious side effects. After applying the ointment, wash your hands unless you are treating an area on the hands. Avoid getting the product in your eyes, nose, or mouth. If it does get into these areas, rinse right away with plenty of water. The dosage of the ointment depends on your medical condition and how you respond to the treatment. Do not use more of this product, use it more often, or use it longer than directed. If your condition does not improve or gets worse, or if you think you may have a serious medical problem, seek medical help right away. Some temporary effects like redness, stinging, or irritation at the application site may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If your doctor has directed you to use this medication, remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Get medical help right away if you have any very serious side effects, including slow/shallow breathing, slow/irregular heartbeat, seizures. This medication has rarely caused a very serious, possibly fatal, blood disorder, methemoglobinemia. This effect is more likely if you have breathing problems, certain diseases of the blood, or if you smoke. See also precautions section. The symptoms of this disorder may occur within minutes to a couple of hours after using this medication. Stop using this medication and get medical help right away if you develop any symptoms of methemoglobinemia, including pale/bluish/gray skin, unusual tiredness, shortness of breath, fast heartbeat, dizziness, headache, confusion. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, new or worsening itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed above, contact your doctor or pharmacist. Before using boil relief ointment, make sure to talk to your doctor or pharmacist if you have any allergies, especially to medications like benzocaine. Also, let them know about any medical history you have, such as broken skin or infections in the affected area, heart disease, certain blood disorders, or breathing problems. If you are pregnant or nursing, it's important to discuss the risks and benefits with your doctor before using this medication. And if you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using. Remember to consult with your doctor before breastfeeding if you are using this medication. When using boil relief ointment, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It is important to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If this ointment is accidentally ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include an irregular heartbeat and seizures. Always be careful to keep this ointment out of reach of children and pets. Make sure to keep up with your regular medical appointments and any necessary lab tests while using this ointment. It's important to monitor your progress and make any adjustments as needed. If you are using this product regularly and forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and continue with your regular schedule. Do not take double the dose to make up for the missed one. Make sure to store the boil relief ointment at room temperature and avoid freezing it. Keep it out of reach of children and pets. Do not dispose of it by flushing it down the toilet or pouring it into a drain unless instructed. When it is expired or no longer needed, be sure to properly discard the product. If you have any questions about how to dispose of the ointment, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.